Lesson 3. Diagnostic performance of clinical laboratory tests. So when you have a health check report, you may ask a question, what is the meaning of reference interval? And you can see that if there is any flagging of the results, that indicate that your results is out of the reference interval. Am I really ill? And the report say that I'm normal or abnormal. So are the results really accurate and reliable? But based on all these, based on all these questions, based on all these questions, firstly you have to know that why you have to test these biomarkers. A biomarker actually is a biological material in your body that we can detect and measure in the clinical samples. And the level can indicate if you are normal, diseased, or have a risk of getting a disease regarding to the reference interval. Reference interval is the cutoff value of a laboratory test. It can be set by population or by risk of a disease. For the population-based reference interval, there are two threshold values, the upper and the lower threshold. In between these two values is so-called normal results. So how to determine these two thresholds? The test results should be obtained from samples collected from a defined population, usually more than 200 healthy subjects. And then we will take the mean plus and minus 2 standard deviations. So it can cover 95% of the healthy population. When we set the population-based reference interval, the research study will also focus in particular gender, age, or physical states. For example, the red blood cell count and hemoglobin concentration is higher in male than in female. Other than population-based reference interval, the threshold of a test can also be set by risk of a disease. So it is used to assess the risk of establishing a disease but not for diagnosis. For example, the total cholesterol can reflect the risk of getting coronary heart disease. So the reference interval will show that the desirable level, the borderline risk, and the high risk level. Total cholesterol is a risk assessing test. For example, total cholesterol is a risk assessing test. The reference interval showing the relative risk of different levels of cholesterol. These reference intervals usually recommended by research institute after a medical research study. So for us, we should keep our cholesterol level lower than 3.8. In this case, these people have a high risk of getting coronary heart disease. So now you know what is biomarker and how to interpret the results based on the reference interval. But do you know the test results is reliable? So you have to check the diagnostic performance of a test. A clinical laboratory test should be accurate, precise, sensitive, and specific. Accurate meaning when you repeat a test, the test results usually can meet the target, reflecting the true and actual value. Precise meaning when you repeat the test, you can obtain the same or very similar values. In the ideal case, we do really hope a diagnostic test can provide accurate and precise results. Other than these two performances, we also want the test to be sensitive and specific. Clinical sensitive, meaning the test can find out the diseased cases and show positive results. It is said that we can find out the true positive. For clinical specific, that means the test will not count for those who do not have disease as a positive. That means it can find out the true negative. Clinical sensitivity is used to describe how accurate a test to identify patients who have the disease. It can be calculated by this formula using the true positive and the false negative cases. For example, in this test, it can find out all of the diseased people as positive, and there is no false negative. By plugging into the formula, we can find that the sensitivity of this test is 100%. It's really good. No diseased case is missed. Take another example. In this case, some of the normal people was falsely counted as positive. But by calculating the sensitivity of the test, still all the diseased people are tested to be positive. So the sensitivity of this test is still 100%. No diseased person is missed. Other than sensitivity, we will also check the specificity of the test. It is used to describe how accurate a test can identify people who do not have disease. It can be calculated by the true negative and the false positive cases. Take an example. In this case, all the normal people, all the healthy people are counted as negative. So there are no false positive. That means the specificity of this test is 100%. Very good. In the second case, 3 of the healthy people was wrongly counted as positive. So that means there are 3 false positives in this test. The specificity of this test is now only 50%. It's not specific at all. But it is a good, but is it still a good test? So we have to think about the role of a laboratory test. There are 3 major roles of laboratory tests. The first one is risk assessment. For example, the lipid profile, it is used to assess the risk of getting coronary heart disease. It can also be used to monitor the treatment. For example, prostate-specific antigen can be used to monitor prostate cancer during and after a treatment. Most importantly, laboratory tests can be used to detect and diagnose disease. But there are 2 functions. It can be a screening test or it can be a confirmatory test. As a screening test, the cutoff should be set towards high sensitivity. That means the results of a test can have false positive. But doesn't matter because it is used to identify individuals who have the disease. We don't want to miss anyone who have the disease. And usually, these screening tests are non-invasive or relatively less invasive. So when the screening tests have positive results, we will proceed to confirmatory tests. These tests will have a cutoff set towards high specificity. These tests should be precise and accurate to avoid any false results. So it aims to confirm the true disease cases to whom have positive screening test results. And sometimes these confirmatory tests are invasive. So that's why we will firstly do the screening test and then do the confirmatory test. Take an example. When we want to confirm a colorectal cancer, firstly we will do the screening test. Fecal occult blood test. It is non-invasive. It just tests the presence of blood in the stool sample. If the result is negative, because this is just a screening test, the result is not 100% accurate. So you will suggest to repeat the test every 2 years as a health check. If the result is positive, that means there are some blood detected in the stool. You will be advised to have colonoscopy examination. And during the colonoscopy, if there is any polyp or abnormal condition was found, the physician will collect the colon biopsy, take out the polyp or a piece of tissue during colonoscopy. Take it out and send to the cellular pathology lab to confirm whether it is a benign case, that means normal, or it is a malignant case. So actually it is more invasive, but it can be the best confirmation test of colon cancer. Finally, there's a quiz. Please calculate the sensitivity and specificity of the following lab test. In this population, there are 5 normal people and 4 diseased people. And finally, this test can find 3 of the diseased people as positive, but 1 of the diseased people as negative. So, putting the number into the table and then plug in the number into the formula, you can find out the sensitivity should be 75%. But for the specificity, they are 100%. That means the test is specific, but not so sensitive. It can be used as a confirmatory test, but not a screening test. In this lesson, you've learned that biomarker levels can be vary in particular gender, age, or physical states. And when you interpret the test result, you should base on the reference interval. And the threshold was set by population-based or risk-based study. To check whether the test result is reliable, we have to consider the diagnostic performance of the test, whether it is accurate, precise, sensitive, or specific. And the role of the laboratory test is actually to assess the risk of a disease, to monitor a treatment, to screen, and also diagnose a disease.